we've just engaged the anterior core, front side of your body. The previous week, making sure all that is firing and functioning properly. The reason why I like to do that side of your body first is because when you go and end up engaging the posterior chain, meaning spinal erectors, QL, glutes, hamstrings, and all that, if you don't have all this working first and you go to do those exercises, you'll hyperextend your back. So you could do squats, you could do bridges, deadlifts, and all these things, but if your anterior core isn't working to keep your spine in neutral, then you're going to always hyperextend that back and lose the stability there. So we've just done all that the previous week. Hopefully you've gained 6 inches, like I mentioned. You might have gotten taller. You're feeling a little bit stronger. Now we're going to move along to the back side. Okay, so again, we're back on our mat. You don't really need many tools for this. If you want to use some sort of stick, dowel, broom, or a band, which I'm going to show you each of those exercises for those, then you may, but it's not necessary. So the first one, you're going to be laying on your back. One of the first things that we did last week was doing the posterior pelvic tilt, where I inhaled, exhaled, belly button drops, pull the pubic bone towards the sternum, squeezing. So we're going to incorporate that with the next piece. So we're moving right along into a bridge, but doing all that first, which is going to look like this. Once I can't go any further with this flexion, I push through my heels to squeeze my butt up as high as I can, keeping this shortness in my core. So I'm squeezing my abs, but my hips are going as high as I can. And then I relax and go down. Again, I inhale, so I'm totally relaxed here as I inhale. Exhale, pelvic tilt, squeezing, then roll, pushing through the heels, keeping the core engagement on the front side. Activate the glutes as high as you can with the hips. Still exhaling, and then relax. So my inhale, full inhale, as I go up through the motion, the exhale is consisting of this entire push. And that's important for that TVA engagement like we've talked about. Now, like I mentioned earlier, if you don't have the anterior core engagement like we've worked on, then as you do an exercise like this, you'll hyperextend your back. So I'm going to demonstrate a bridge where I'm not keeping this. If I push my hips up, I can go super high, but now I'm really arching my back. So I actually feel a ton of spinal engagement here near the SI joint and really low lumbar area. So my back is actually working harder than my glutes here. And that's not what we want. We want the glutes to be working more than anything else, along with the hamstrings. So another poor example would look like this, just pushing the hips straight up and arching the spine without doing that pelvic tilt. So now I'm pulling my abs down. I'm no longer feeling the back there. I'm feeling more of the glutes, abs, and hamstrings. So like the previous week, we're doing about 1 minute of that, setting a timer, going through that motion, focusing on the breath and the movement specifically, not any amount of repetitions. Yeah, keep going. That part, you know. So now we're going to get into a single leg bridge in a figure 4 situation. Now, there's plenty of ways that you could do a single leg bridge, just like there's plenty of ways you could do a 2-legged bridge. I like to do this one because we're mobilizing at the same time and we're creating a little bit more of a hip engagement as we do it. So here, I'm going to place one ankle on my other knee. And my foot is still close to my bum here. I'm pulling these toes towards my shin, and my knee is pushing down away from my chest. Okay? Figure 4 position. Okay? Now from here, I'm going to do the same pelvic tilt that we practiced. It's a little bit more challenging in this position. Breath, exhale. Push through this heel to activate this right glute. Abs are still engaged. Pushing this knee down as high as I can go, still exhaling. And relax. So again, inhale, pelvic tilt with an exhale. Continue up into the bridge with one leg. Squeeze that right glute as high as you can go. Abs are still tight. Really feeling especially the outside of this right hip, right hamstring. So you're doing about a minute per leg in that one. Okay. Now from there, we're going to get into a different kind of bridge now, where the feet are elevated on the wall into like an inverted chair position. So I'm at about a 90-degree angle in the hips and the knees. My feet are hip width apart, okay? Not shoulder width, hip width apart, okay? So we're not gonna do the pelvic tilting the entire time we go through this motion like we did in the previous bridges, but you're gonna do it once. So if you wanna practice the breath with it, I always recommend that. Inhale, pelvic tilt once, pulling the sternum towards the pubic bone. Notice my hips begin to come off the ground a little bit. Once you can't go any further here, you push through the heels to activate the glutes and lift your butt just a little bit more, okay? And you're just hovering here. So you're pushing through the heels, feeling those glutes and hamstrings activate, keeping this engagement. So I'm really squeezing here, and watch my breath as I hold this position. Like I said earlier, there's no posterior chain engagement without anterior chain engagement. So you gotta have all this to be able to do this, okay? With a band, the only thing differently would be to add a little abduction and glute medius engagement by pushing the knees out as you do that. And then same thing, you're lifted, okay? Pushing through the heels, feeling the glutes. This is gonna get more activation in the lateral part of the hip, and breathing here. Not too complicated. Okay. So we're gonna move back to the mat. Everything we've just done is working in the supine position, so basically laying on your back. The reason why we're doing glute engagement, posterior chain engagement, laying down into this next position is going to be tabletop, as opposed to doing standing exercises, because most standing exercises where you would engage your glutes, which would be like a deadlift or squatting or single leg RDL or straight leg, double leg RDL, all of those things require a hinge in your body and stress the back out a lot more. So any sort of bending motion. So if I'm bending forward, if I'm doing a deadlift from the ground, great posterior chain activation there, but it's too much stress for the lumbar spine right now, especially if you're experiencing pain. Bending, twisting, those things can be pretty gnarly for you. So we're avoiding all that for now, doing all this stuff so that eventually you can do all that, because all that stuff is great and necessary, but all this has to come first. So the next one is going to be, the next series of motions are going to be in the tabletop position, as I mentioned. Tabletop being on our hands and knees. So when you're in this position and we're engaging the glute, it requires a lot of anterior chain engagement, as we've talked about, because it's essentially what's holding you in place, okay? So in the previous video, I told you about posterior pelvic tilt here, where we do this little adjustment. Okay, I'm pulling my belly button up and squeezing my tailbone forward, okay? So you must keep that as we go through the next series of motions. And that first one is very simply what many call a donkey kick. It's a hip extension, your knee remains bent. And it's gonna look just like this. My arms stay straight, my core stays braced. I'm gonna kick my heel back and up towards the ceiling to feel my left glute and hamstring. Come down and repeat. Feel that glute, feel that hamstring. Okay. Now, I'm going to show you a couple poor examples now. As I mentioned, this part of the body needs to stay rigid and strong so that when you kick your heel up, watch my spine now, watch my lumbar spine. I'm in this good position. If I kick my heel up and I arch my back like that, I'm using spine again. Okay, I'm using all my spinal erectors, Q out, and I'm stressing the lumbar vertebrae again. Okay, I'm not using as much glute, I'm using more back. Okay, those erectors. So by staying stable in the core, anterior side, and kicking that heel up, we're getting that proper engagement without overworking the back. Now you see a ton of people do this, especially with the craze of booty building exercises, right? It's super popular. You see a ton of people doing this stuff, clamshell, heel kicks, and it's all super quick, but none of it is stable. There's no real engagement happening. You might be able to build like some power, some toning effects, but there's no true engagement that's gonna essentially keep your back healthy, keep everything firing the way it should. So you saw my low back arch, but there's also kind of a fault when we twist in that position. So I like to use a stick, especially with all my clients. I put the stick on my low back. There's plenty of different things that you can use. You can use a yoga block for this. You can use a tennis ball right in the middle of your spine. Okay, so what I'm gonna find here is that posterior pelvic tilt, so I'm not arched. You can see the stick move when I do that. But I'm gonna do that tilt just a little bit, so the stick is right there at the top of my sacrum and the bottom of my spine. Now that same exact motion that I just did, the donkey kick, is gonna happen, and the stick is gonna stay exactly where I put it. Now if I do it poorly and I twist and lose stability, I arch, twist, and that stick goes. So it's a really great feedback for me, for my clients, to make sure that we're staying stable, not arching too much and not twisting too much. Arching too much, twisting too much is going to be what stresses the spine out more. Now, there's variations of those donkey kicks that I'm going to show you now, and all of it's going to be in this tabletop position. So if your wrists get tired, your arms get tired, shake them out. If the wrist gets sore, turn the fingers out like so. That can be helpful. A really good indicator that you're not doing well and staying stable is if arm bends. So if I go through the motion with my left leg and my right arm bends, I'm obviously dropping my shoulder down. I'm twisting there. And the stick will tell you that as well. So for the next one, I'm just going to use the stick so you can see that I actually practice these things and I'm good at them, because that's all I really want in life. I just want to be validated in how fit I am. So here in the tabletop position, again, I'm going to do a straight leg extension, squeezing my left glute and hamstring. A little bit of that core engagement, arms straight, kick that heel straight back. Super slow. It's not about how high my leg goes. There's the arching again. It's about the legs straightening completely and keeping this core engagement at the same time. Toes are not pointed. They're pulled towards your shins. Okay? So my hand remains down. You can alternate that. It's always good to notice what side feels better too. My left glute tends to have more issues in engaging, so I really have to focus on that side. And as I go through these, I'm not just feeling my leg, like I'm quite literally feeling the front side of my core as well. So to say that this isn't working as I'm doing the backside would be ridiculous. This is working quite hard at the same time. So we have the glute engagement there in tabletop. We're gonna do glute medius activation in a hip abduction. So similarly, you're gonna use the stick for feedback. And I'm gonna drive my knee directly out to the side of my body. Body stays stable, core is braced, knee drives out. Notice the stick. It's not going like this as I twist the spine. It's not going up, it's not going side to side. It's staying nice and stable. My knee goes directly to my side. What tends to be a common issue here, aside from the twisting in the spine, is when my knee abducts and goes out to my side, is the knee will come forward. That's going to engage the hip flexor. Okay, that's the exact opposite of what we want. So don't let it go forward. You want it to go directly out to the side. So I feel more of the outside of my hip in that glute medius. Okay, outside of the hip socket here. And you can see in my sweet new pants, hopefully that part of my butt engage as I do that. Very slowly. During all these tabletop positions, make sure you breathe. I talked a ton about breath before, where you're laying on your back, you're doing the pelvic tilting. When you're in this tabletop position, it's kind of harder to focus on that because you're focusing on arms, you're focusing on core, you're focusing on the movement. It's a ton of things to focus on. So just focus generally on breathing steadily to keep your endurance going throughout the motions. Now we're going to go into probably the most complicated we've done thus far as we're progressing through these hip engagements, is a controlled articular rotation in that tabletop position of the hip as well. So stick, hands into the shoulders, knees into the hips. You could go both directions with this, and I'll show you each. So my core is engaged. I'm going to do the donkey kick. Glute engaged there. I feel it. I feel my hamstring. Now I'm going to push my knee out to the side. Now I'm feeling the outside of the hip, glute medius. So I got all the glutes working within this slow circular range. Once I get forward and I'm just to the side of my hip, not forward here, I'm going to drop. And I'm literally going this slow. I go up and back. My abs are engaged. That's as far as I can go. I go out to the side, slow, keeping it high off the ground, as high off the ground as I can without twisting, just like before. And we could go both directions. So as I said, you can go directly to your side first, abduct, then back and around, feeling the glute and hamstring here. Then I go down. Abduct, back and around, glute and hamstring here. So you're certainly getting sweaty after all that. You're moving that slow. Yeah, okay. So just like before, you're doing a minute per each of these movements. I mentioned that already. I just want to reiterate that you don't want to be focusing too much on like counting, okay? You're focusing on the breath in the previous exercise, and you're focused on the precision of where you're holding yourself in all of those tabletop positions. Now, the very last one that I'm going to offer you guys is going to be prone and on the ground. And with this one, similar to the very last exercise we did in the anterior core, it's important that you don't hyperextend your back. So we're finishing with those types of exercises because they tend to be the most problematic in coordinating the spine in the position. So you're laying on your stomach. The forehead is resting on the backs of the hands, and you're going to bend your knees to 90-degree angle, keeping your feet together, okay? So from here, we're going to engage our anterior core by pulling my belly button into my spine. You may just barely notice how I pull my belly up into my spine like that. My butt looks like it's kind of sticking up, but I'm engaging the front side of my core. Now from there, I'm going to squeeze my glutes down. And by doing that, I'm pushing my heels up. So you're not seeing much motion, but my knees have come off the ground. And then I relax. Again, I brace my abs, squeeze my glutes down, drive the heels up, and relax. So everything back here is firing big time. The spinal erectors are working as well, but as long as you go through the process of glutes engaging, the anterior core is staying engaged to begin with, and then pushing up, it's totally safe and really, really great for you. Again, doing that one for about a minute. So you've just gone through entire posterior chain engagement. As I mentioned earlier, you're going to progress to more difficult things, but all of these things done on the ground consistently over the next week, maybe even longer, this is kind of like my routine. To keep my back healthy, I'm doing these things, everything you've learned so far, consistently together as I progress. So just this week, you're focusing on all these, but just in the future, be aware that eventually we want all these things to be working together. That's how you're going to maintain that low back health and eventually rid the pain forever. So do this week, stay consistent with it, get back to me on how you feel after. This time, you're not going to feel about 6 inches taller, but you're going to feel nice and firm in that backside, and you're going to want to go sprinting, running, jumping up and down, and full of joy.